So welcome to Bitesize Edge, and here we are with another interview with someone I'd like to refer to as an Edgeite. Today we're going to be speaking with Emma James from Emma James Physio, who joined us tail end of last year, wasn't it, Emma, to come and do your prac course?
Yes, middle of last year, yeah.
Middle of last year. How long ago? So what, a good 6-7 months ago, potentially?
It was August last year.
Right.
So nearly a year.
Gosh, that's gone quite quickly, hasn't it? So Emma, I'm really intrigued to find out how you found out about NLP in the first place. What led you from the world of physio? What led you to want to find out more about neuro-linguistic programming?
I think as a physiotherapist with sort of over nearly 25 years experience, NLP has always been, is often spoken about in the physio world, and we talk about neuro-linguistic programming in terms of sort of PNF patterning and changing movement patterns. So as a physiotherapist, I always I'm trained as a movement specialist, really, identifying why a movement pattern has become dysfunctional, and then re-educating and restoring normal movement. And as part of that, my passion has always been to not just treat the symptoms, but to get to the underlying cause. And as part of that process, communication and changing behavioural patterns is very much part of what we do as physiotherapists. And I heard about NLP probably, it was very, very trendy in the physio world about sort of 10 years ago. And there were quite a few physios that were being trained as NLP practitioners. And at the time, my personal practice and development was at a different place. So it wasn't something that I was ready to engage with. But having met Pip and Jules, I felt that I wanted to go to the next steps. And in terms of running, so I'm a practicing clinician, and I also run a business, and so that in itself, has challenges. And I'm a mother of 2 young children, so I wanted to see how I could improve my own communication, so that I could be a better manager, a better physio, and a better wife and friend, etc., etc. And I felt that by improving and understanding how I communicated and how others perceived me, I would then be able to help to learn to help others help themselves. So identifying what was limiting them. I fundamentally believe that sometimes people's beliefs about a situation can be as limiting as an amputation or a crutch or a splint. And understanding and teaching people how to find a new pathway and a new way through has improved and accelerated my healing potential as a therapist. It's improved my outcomes. I would certainly say that as a therapist, I tend to see quite a lot of complex patients that come to me with multifactorial issues, and it's understanding what the driver is for their pain, and because they primarily come to me with pain or anxiety or depression or long suffering illness, and so actually the fundamental belief patterns around those scenarios are as strong as the mechanical movement patterns that they come with. So really the two sit very well hand in hand.
And with that, because I find that fascinating, because for a long time NLP has been on the periphery from the medical environment, because it's been about how can you scientifically prove it. And there's been lots of work done recently around neuroplasticity that demonstrates the impact of neuro-linguistic programming, and how by realigning pathways can make such a big difference. So I'm really pleased that it's being embraced more in the medical fraternity, for want of a better phrase. When your client, sorry, go on, Emma, what you can say?
I was just going to say, absolutely, because from a neurological point of view, so when we're dealing with patients who've had a neurological deficit, such as a stroke or an embolus or a brain injury, it's all about neuroplasticity, and it's all about the brain's capacity to learn a new movement pattern. So if the brain has the capacity to learn a new movement pattern, then it learn a new cognitive and communication pattern. And your beliefs and what you say and how you perceive things do have a fundamental physiological effect on your body. So the two, clinically, scientifically, and in practice sit so well, hand in hand. It should be taught in every physio degree. It really should.
Okay, that's interesting. I'll let you fly that flag for us. That'll be brilliant. So coming back to, so let's take one of your patients potentially that rocks up with a physical manifestation of some sort or another, something that's happening for them that all they are present with is the physical impact that it has. Okay. Do you ever find yourself in a situation where it can be a challenge for that patient to start to identify the link between the way they think and the physical restriction, whatever it might be, that they have?
Absolutely, and I think that's where it's about being gentle and being kind and listening to the patient and gently drawing comparisons. So recently, for example, I had a young lady who'd been under a huge amount of emotional stress through events that had occurred in her life. She was getting married, she had a young child who had autism. She'd recently lost her grandfather, who is a big influence in her life, and she developed this really, really severe, paralyzing anxiety and fear of flying. And the difficulty for her was that she was flying to Greece to get married. And in association with that, she also had a huge amount of physical symptoms, pins and needles, pain, headaches, migraines, which had all been explored clinically. So which is great as a physiotherapist. We are part of the medical profession, and we are much more holistic in terms of identifying whether there's an underlying cause. So I will often send my patients for scans or investigations to make sure that there's no other driver that may be causing their symptoms. Because people can present with lots of weird and wonderful symptoms, especially when the sympathetic nervous system is involved. And the power of touch is really, really, really important. And nowadays, people don't touch, they don't embrace, everybody's much more removed in terms of their communication. Everything's technological. Nobody wants to talk anymore. So by touching and talking and explaining, I always go back to the anatomy. The anatomy never lies. It doesn't change. You can show people the neural pathway. You can show how one area of the body is attached to another area of the body, how the neural pathway of communication, how a nerve receives its information. It's there in black and white. It's not weird and wonderful. It's not, you don't have to go on a journey. The clinical information is there. So once you've been able to identify and demonstrate their physical systems, their physical manifestations of their pain or their problem or their limitation, then you can gently start to explore some of their belief systems. Now, some people are very set in their ways. They have a very strong belief as to why something has happened. And that, I think, can often be a barrier to them getting better. With exploration and understanding why they are in the situation that they are when they present to you, can just gently help them find a way through. I mean, another prime example of a patient who functioned at a very high level, had severe chronic pain post-surgery, and she was continually looking for a clinical reason why she had the pain that she was in. And she repeated to me on a number of occasions, I wish I'd never had the surgery. Everything was fine before I had the surgery. I had the surgery. But you can't change that. You can't, cannot undo the fact that she's had the surgery. What we must do is we must try and help her find a way through and understand that, you know, your belief system and what you feel and your perception of a situation actually can become almost like a self-fulfilling prophecy. And that it starts to create its own momentum. So you can clinically you can start to experience allodynia, which is painful sensations in response to normal stimulus. Now, if you can feel that on a physical level, it happens on an emotional level as well. You know, I can't get up, I hate getting up, I'm in pain, if I do this I'm going to be in pain. Well, you know, it's a self-fulfilling prophecy. If you see it, you believe it, you become it. And I feel that really strongly and really passionately about that.
Okay, I can tell, Emma. But it's very true, isn't it? I was listening to a really interesting article the other day about the difference between us and animals, for instance. So we will project our fear created by historic events onto the future. So we might choose not to do things for fear of repeating something that's happened previously, or we might have a level of anxiety around something new for fear of the unknown. Kind of those two go kind of shit. I'm in the middle of that. Where am I going to go? Whereas an animal might be grazing, you know, muntjac deer might be grazing in a field. The fox appears, it goes into the fight or flight mode, runs, and then loses the fox and then starts eating again without a care in the world. It doesn't start going, I better keep an eye out for another fox. Are you with me? So
exactly,
it lives very much in the moment. Now, you could say actually the muntjac deer needs to learn something from that previous experience. But the interesting thing is what it's not doing is impacting its present moment by worrying about the past or getting stressed about what could happen in the future. And for me, that's really powerful, because it's almost like a level of acceptance. You were saying about, you know, the person you're referring to almost being in a position of acceptance. You've had the surgery. You can't change anything that's sat around that. So what can you do?
And also, I think one of the really, really tangible, clinical and scientific responses is the fight or flight response that you talked about. Yeah. So your fight or flight response is there to be a short-term fix to a solution. It is fight or flight in a death scenario. So your body releases cortisol and adrenaline. That has a physical impact on your body. Now, when people are stuck in adrenal fatigue or adrenal overload, or in a stressful situation, your body doesn't stop responding to that fight or flight scenario. And then what can happen is that can become the norm. That can become the baseline. And often is the reason why people have a lot of mechanical pain, have a lot of joint pain, have huge amounts of fatigue, is because they are stuck in a scenario of adrenaline and cortisol surging through their system. Yeah. And I often use the analogy with my patients that if you envisage a little can of hairspray sat on top of your kidneys, they're your adrenal glands, and every time you have an anxious thought, or you have a negative thought, or you have a fearful thought, that little can of hairspray secretes some adrenaline or cortisol. That has a clinical effect on your skeletal system. And it makes your shoulders tight, it makes your back stiff, it makes you feel flushed, it increases your body temperature. And over time, that really has a huge impact on soft tissue and the body's ability to repair. Right. So the body can only deal with so many things. It can only transmit and deal with so many neural pathways at any one given moment. Yeah. And if your body is continually in that fight or flight, you cannot heal. Yeah, it's like the stress surrounding IVF and fertility and trying to get pregnant. If you're in that constant fight or flight, the body's trying to survive. So it can't upload any energy to heal, to create the right environment for an embryo to sustain life. And I think healing is so much around creating the right physical, nutritional, emotional, and psychological environment for optimal recovery. Hence the reason we do a lot of work at Champneys, because when I used to work in London, one of my first clinics was in Gower Street, and clients, and I'm very military upbringing, so I always run my clinics on time, but this was like nearly 20 years ago, they'd arrive having really fought to find a parking space, having paid a fortune to park. They'd run in, it takes the first 10 minutes of the appointment to calm them down. I do a few things and then they're out the door and back on. You're not, I mean, look, they got better, but they're not in the best, scenario and environment. And the patients that come and see me at Champneys, they're like, oh, as I drive up the drive, I feel better. I can park outside the clinic. It's a lovely environment. And after my physio, I can go for a walk. Yeah. For me, it only improves the outcome. So you can change the physical environment. You can change the emotional environment, the structures are sitting in. People get better quicker.
Yeah, it's incredible, isn't it? So one of the things, before we started the podcast, you were talking to me about having just completed another set of qualifications to do cancer treatment.
So I'm really passionate about women and women going through. I'm in my 40s now. I've got 2 young children. I run a successful business, and it's stressful and it's sustained stress. And I have a real passion for women being accepting of their bodies and shapes and sizes and going on a journey. And I think that we need to embrace the fact that many men and women are now recovering or having an extended life during cancer recovery and during their cancer journey. So I'm just one of the very few physios in the country. They're very cutting edge in New Zealand and Australia. A lady called Lou James is a physio championing exercise during your cancer journey, and also the treatment of any side effects as a result of radiotherapy, etc., etc. So I'm now a pink and steel physiotherapist, and I do a lot of work with women recovering from breast cancer, abdominal cancer, ovarian cancer, you name it. And so some of that is around manual therapy, dealing with restrictions, etc., etc. But a good 70% of that is around listening and guiding and advising and pacing. And I really feel like my NLP qualifications really sit, I feel like I've got the trifecta, right, okay, I've got all of these years of looking at things mechanically. Now I look at things emotionally, and together enable people to live, live greater, more fulfilled lives. So it's really powerful. I'm really encouraged by what I'm doing.
That's incredible. We've had over the years, Edge has been going 10 years. We've had the privilege of working with a number of people who have either gone through or are going through their cancer journey, and treatment, everything goes around it. And it's been a consistent theme for all of them, where they have found NLPs to be hugely powerful for them. Depending where they are in their journey, it's been powerful for different ways and different reasons. But the consistent element would be around being able to take ownership for the way that they're thinking.
Absolutely.
And move from being, because none of them are asked to be in that situation, but moving from being in the place of kind of questioning it to being almost in a place of acceptance. Again, a little bit like we talked about earlier, the example you gave of the lady who had an operation. about getting to that place of acceptance and recognizing the power of the mindset on their journey to
Absolutely.
recovery.
Yeah, and I think at the end of the day, you know, we have to accept that shit happens. You know, you can protect people, you can protect yourself as much as possible, but shit is going to happen, and you have to. People always say to me, Emma, you're so positive, and I'm like, look, you know, there are some days that I can't, you know, I struggle to drag myself out of bed, you know, as I'm sure you do. But at the end of the day, the sun is going to shine, right? And the day is going to happen. And I'm either going to embrace it and I'm going to try my hardest. And maybe on the days where I'm struggling, I'm going to wear a little bit more makeup and I'm going to swear a little bit more. But I'm out there and you're doing your bit. And actually, the more you engage with people, the more you communicate, the more you have that self-belief, the better you will be, the more successful you will be. You know, all of the business gurus are like, you know, what you focus on, you become. You know, what you focus on, you grow. So, you know, you can either sit there and be the victim, or you can choose to take a different stance and a different path. It doesn't mean that things aren't going to suddenly become easy, but having those tools, you know, an athlete will learn, will go to the gym and will eat the right nutrition, and they will learn how to, you know, run a race. You know, if you're an accountant, you learn how to deal with, you know, books, etc., you know, and accounting software. So actually learning and understanding how your mind works and what you can do to change it is really powerful from a personal development point of view. And also I would say that if I've had challenging relationships, you know, or situations, they've been much better. It's been easier. Look, it's not always easy to say to somebody, I don't really like the way you're talking to me, or that makes me feel not so great. But you know, some people don't know. They're not always that self-aware of how they make others feel. So actually gently highlighting or gently giving somebody a couple of hints and tips can have such a compounding effect. It like really powerful.
Yeah, totally. So Emma, where to now for you? Where are you going to go to from here? You've got a very successful business. You talked about you're a wife, a mother, a friend, and many other things, I'm sure, along the way. Where is your journey going to go to next, and how does NLP fit into that personal development and professional development for you?
Well, I don't think I'm going to stop being a clinical physio, you know, and for me, it's not about, people measure success in different ways. You know, lots of people measure success from a monetary point of view. For me personally, as long as my business is profitable and keeps my staff employed, that's obviously, you know, baseline number one. But beyond that, it's about fundamentally fulfilling me as a person. You know, I love doing what I do, and you know, I'm really, really good at it. And I really feel like communication is so important. It's so important with what I do as a therapist, what I do as a businesswoman, and also what I do as a mother, bringing up two, you know, gorgeous girls in a challenging society. So I'd really like to continue my NLP practitioner journey, because I feel really clear as to where I am now, and I practice a lot of the techniques that I've learned, but I really feel like hypnotherapy is something that I would be my next qualification. To just drill down a little bit deeper into helping people change their fundamental drivers, and to be an NLP, you know, sort of master practitioner. I don't want to become a business coach or a coach. I think that I have a really, really powerful set of tools, and I'm in a really good position to drive my profession forward. And as a female businesswoman in my profession, that we're quite few and far between, and I'd really like to be a really strong, positive ambassador for what we do as a profession, and understanding much more holistic healthcare and health and well-being.
Brilliant. So a complete offering.
Yeah, absolutely.
So what would you say to anyone who's considering exploring the journey of neuro-linguistic programming? What would be your pointers?
I would certainly say, for anybody who sits in any position of authority or communicates, anybody who communicates really could do with a one-day course, you know, to understand how we can communicate better with our husbands, partners, children, etc., etc. So, you know, I think that there's a huge area for parents to understand how to communicate with their children through different different times in their lives. I think anybody who sits at any degree of middle management or senior management level, you absolutely can learn a huge amount in the 6-day course.
Yeah.
You know, not everybody will want to go on to you know, the different levels, and I don't think that it's a case of you have to do everything to be qualified. I really think it's understanding, whatever you do in your profession, it's understanding the parameters and the boundaries of what is your envelope of comfort, and knowing when to refer on. Does that make sense? So you are a much more powerful manager, boss, wife, husband, if you're able to admit when you're wrong or whether this is outside of your scope, and knowing who your experts around you are. I really feel, especially in this day and age where people communicate so much digitally, that the art of conversation is being lost. And I think we have a really, really important job to do.
Fly that flag, Emma James, fly that flag. I agree with you completely. I'm often have conversations in the office, and it's like, okay, well, we need to follow up on something, and it will be, let's send an email. And I said, no, let's pick up that phone, that little thing over there. Let's just pick it up and see what happens when someone speaks to us at the other end. It's quite extraordinary. I don't think we can do enough of it, to be honest, but that's my own personal view. So,
and I think as well,
I was just
going to say, and I think as well, having that, things escalate very quickly on email and text, etc., etc., and actually just looking somebody in the eye and just saying, can I, you know, would you mind? And sometimes something that's really easy, 2 minutes, can clear something up, which actually can have, manifesting, you read too much into something. I'm terribly dyslexic, horrendously dyslexic. You'll know when you read my emails, they're bullet points because I can't join the sentences together. So I always say to people, if you don't understand what I've written, call me, because I'm much better verbally. And I don't think I'm alone, and some people articulate themselves in the written word very well, others don't. And I think that you should never, ever use the written word as the only form of communication. Body language, touch, eye contact, it's so important.
Yeah, no, I agree with you completely. The whole our whole model of communication is incredibly powerful, and there's a phrase that I absolutely love, which is, we're saying more when we're not saying words than we are when we're using words, because of everything else that's being expressed. It's absolutely key. Mm-hmm. So Emma, how can people find you? Anyone listening to the podcast who might want to come and hang out with Emma James and have some physio done or whatever, how can they come and find you?
So we have clinics in Hemel Hempstead, Champneys in Tring, Fleet Street, and also Westminster. We are on the website www.ejphysio.co.uk. Our central head office is 01442 870 686, and on Instagram we are at Emma James Physio. So yeah, come and find us. We love to share journeys, and I know that you and I work together well. We bounce ideas off of each other. I've got a client. What do you think, etc., etc. I think it's okay to say I'm not sure, and ask people. It's really powerful to ask people to be pointed in the right direction.
Fabulous. Thank you, Emma. Thank you. So for anyone listening, please come and follow us on Spotify and on iTunes, Bitesize Edge NLP, and we will be interviewing some more Edgeites over the next coming weeks. So do come and hang out with us and share as well. Please do share our podcast accordingly. Emma, thank you for your time. I really appreciate it. Enjoy the rest of your stay there in Saudi. Didn't really mention that, but you're out there enjoying yourself. You say it's work, I'll give you that. And thank you for your time on the podcast. Really appreciate it.
No problems at all. Always here to help. Take care.
Take care.